for the last couple of years, I started having nosebleeds. They were never very severe. I went to the doctor a couple of times. We couldn't really figure out what was causing them. And then about 4 months ago, they became terribly severe and would last a half an hour at a time. And so I went to my internist who had me do an MRI and said, well, the good news is you have no tumor, but the bad news is you are not formed correctly. So that's when he sent me to Dr. Pero.
One of the newer technologies that we have over the last few years to help people with not only nasal obstruction but with sinus infection, sinus problems, is balloon sinuplasty. And balloon sinuplasty has been an excellent advancement in that it is a relatively less invasive or non-invasive technique to help open up the sinuses.
I think I had just a congenital issue, and he said, I really want you to come look at your MRI. I said, but I have just a vessel, I want you to cauterize. And he goes, no, that's really not it. And so I looked at the MRI, and it all made sense because I've never been able to blow my nose on the left side. Well, it's because that left side was almost completely closed.
The way balloon sinuplasty works is if you have a sinus opening that is narrowed and usually congenitally, in other words, people were born that way, and then if they have a little bit of swelling, say in response to a cold or even a weather change or allergies, if you have a narrow opening, if it swells a little bit, it can swell shut. By placing a balloon into the sinus opening, we're able to inflate that opening and make that opening larger. If you then get the same amount of swelling from the allergies or cold or what have you, it's no longer swelling shut anymore, and the sinus can continue to function as normal.
Dr. Pero told me that he would go in and open up the left sinus cavity where it would actually drain properly and I could breathe through the left side. It was just so successful. It was shocking when I went for my follow-up visit, and he took the packing out and said, okay, breathe through your nose. And I did, and it almost felt like I had too much oxygen. It's a huge difference. Dr. Pero was wonderful, and I would recommend him to anyone.